Good afternoon. I'm going to give everyone a minute to join us. But as a very brief introduction, first of all, I'll say that Daniele and I have already had a few minutes to advance to start our conversation even before everyone here is joined, which is great. And welcome to Change for Good. And it's April 16th. It's 1 o'clock here in Toronto. And it is, amazingly enough, the 5th week that I've been working here at home. And I assume that's the same for everybody here on this webinar. I was saying to Daniele earlier, someone told me that the biggest search term in Google today is, what day is it? So there we have it. That's where we all are today. Anyway, we started Change for Good because COVID-19 is obviously a crisis, and we also believe it's an opportunity for positive change. And so on the one hand, well, so many people are living in a way which is uncertain and vulnerable and without any knowledge of what's going to happen even next week. On the one hand, and on the other hand, we've seen so many incredible examples of positive change, and that's from the business sector, from organizations like the United Way, which we'll hear from, and from individuals themselves. And these are things that I feel wouldn't have happened otherwise. And that's what Change for Good is really all about. So every week I have the great pleasure of speaking with a social change leader and talking about how COVID-19 is affecting their organizations and how they are thinking about it today, and also how it's going to affect things in the future. And today, I have the very great pleasure of being joined by Daniele Zanotti, who is the President and CEO of the United Way, Greater Toronto, which I believe is the largest United Way in the world.
Sure.
So, which is very exciting. And so he has a particularly important perspective, which he's going to share with all of us today, about a few things. Why collaboration and collective action is more important than ever. The changing role of organizations like the United Way and its frontline agencies. And I know that we're all going to learn a lot from Daniele about his organization, and also how people like all of us can be doing things differently. Before we turn over to our conversation, I just want everyone to know that during this 30 minutes, please, you'll have an opportunity to submit questions. If you hear of anything that you'd like to ask about, please send it in, and we'll try to address as many as we can. And welcome, Daniele.
Thank you, Paul. So great to be here with one of my favorite change agents of good, you, and impact.
Well, it's a pleasure, and we of course have had the great pleasure of having many conversations like this over the years, but I think this context makes it particularly important. Daniele, before we jump into some of the more detailed stuff about what you're doing and what your thoughts are, I just thought, I'm always curious because in this situation, I'm always thinking about what's happening in our house here and with my friends and my family, and we've had some very beautiful and positive things happening here. I thought maybe there's something that you could share with everyone just at a personal level about what's happening with you and your world aside from work.
It's definitely brought a lot more traffic to our home with my wife and both my children now, one working from home, another in second year university. It's also brought a deep gratitude for home, for wherever that is, and whoever you get to share it with, for work and the ability to work from home, and for this land that we share wherever you are on this webinar. It reminds me of those who found a home here on these shores in the Greater Toronto decades and decades ago. And we're so grateful for all of the people that came before us, from the Haudenosaunee to the Wendat to the Anishinaabe to the Mississaugas of the First Credit. Just this immense gratitude and blessing of home and family, and somebody who cares enough to say, how are you? Which we know not everybody has in these times.
Mm-hmm. Well, thanks for sharing that. I feel the same thing. There's a level of kind of caring about each other, which has been unusual and very special. So when we were talking the other day, we were talking about how much has changed, and the fact that there are arguably many more people who are vulnerable today than there were even a month or two ago. So I think people would just, as a start, would love to hear your thoughts on, you're an agent of social change. You've been doing this for a long time. How are things today different for you in your world than they were even a month or 6 weeks ago? What are you seeing?
Well, it feels like our entire world, our work, our home has been turned on its head. I mean, in communities across the world, in communities across Canada, United Way is the largest funder of social services next to government. And in the GTA, we fund over 270 agencies, some really small and local, and some really large and covering the GTA or Canada. And, in the past, I would say, Paul, that the very strength of the sector, the big and small, the grassroots and large, has been our strength, the cacophony of care that we assemble on the ground, invisible in normal days, has been our great asset, because we've been able to quietly go about doing the work. And all of the research that we at United Way have done, and that has been done around the world, demonstrates that connected communities where there's a network of agencies are stronger and more resilient. In fact, books like Palaces for the People documents that in times of crisis, whether it's the Chicago heat waves, 9/11, Canada, wildfires, it is in fact communities where there's a network of agencies, people, government, business, donors, volunteers working together, they emerge more resilient than those that are not connected. And so all of the research demonstrates that. Our very own United Way research for the GTA shows that we've got one of the most connected ecosystem of agencies that we fund. They communicate, they collaborate, they coordinate services when possible, and that they are also connected to other sectors. All of this known, researched, but COVID has kind of turned it on its head, because many of those agencies, big and small, have had to close services. Many of those frontline staff without PPEs are not able to go out, do not feel able or vulnerable to go out and deliver. So I think it is putting us into a position of, it accentuates the strength of our work, but it also accentuates some of the frailties. And what's emerging for me is the importance of an ecosystem, the importance of not a fragmented system, but one that can act cohesively. And I'm starting to see paths of how we are getting there, even in things that United Way is doing. But it is putting a tension into my head of the very thing that was our strength in the past may in fact be a weakness for us post-COVID.
Can you, just building on that, feels to me like United Way is in a very sort of a unique animal in and of itself, where you, on the one hand, you're connected with large corporations and other major donors, and the government. On the other hand, you're connected with these, this vast number of frontline agencies. Are there any, maybe you could share some specifics around, like on the one hand, perhaps with funders, how your dialogue and engagement with them has changed, and then also on, with respect to some of the frontline agencies. Like, I think people would love to hear, because you're saying maybe it's not the right, exactly perfect today, maybe it'll change in the future, but share some specifics about like what's giving you that idea now, and what are you hearing from from all these folks?
Well, I think we've responded at United Way in a number of immediate ways and in a number of united ways. So first of all, we provided flexible funding to all of our agencies. We were first out of the gate to say to our agencies, you're connected on the ground, you know best, do with our funding what you need to do. So if we were funding an after school program that obviously you cannot run, pivot and use it for something else. And that general operating service funding, that glue, is so important for, in a time of crisis, for them to meet that need. So that's the first thing. The second is we became, in a very quick and overnight way, this local system solution provider. So we are partnering, for example, with the City of Toronto. We are linked with their emergency response. We are co-chairing 9 place-based community tables across Toronto, and 1 table for the Indigenous community and 1 for citywide. Every day, those community tables convene. They talk about what's happening on the ground, who's closed and who's open, how might they pivot and allocate dollars in new ways. And there's amazing things that are bubbling from that in real time. So we started to hear there were no hand washing or bathrooms for the homeless. And we quickly went back to the city's emergency response and got them to activate that across the city. We heard that there were shortages for food supply. We partnered with the Toronto Public Library, got a couple of our United Way agency together, and now libraries are being used for food distribution mechanisms. So this idea at the City of Toronto, and we've got a local solution for the region of York and the region of Peel as well, of United Way being that intermediary between emergency response at the government level and then those agencies on the ground who can respond very quickly. One example for Caledon Community Services, not only were they needing support to sanitize and practice social distancing, but they still needed to deliver over 300 food hampers. So our ability to provide flexible funding, but then to work with them at a system level, help them pivot and bring in new partners for that work. The third thing I would say we've really focused in on is leveraging other funding from the feds. There was an announcement of $9 million for senior support across Canada, so that United Ways are working with the federal government to disperse dollars into those neighborhoods very quickly. And on all of these, Paul, what would have been impossible just months ago, we're turning applications around in between 24 and 48 hours. So quick one-pagers coming in from agencies, and United Way turning those around very quickly to invest back in emergency response.
Well, thank you for sharing that. I think that brings a really important point, which is the the need for organizations, more institutionalized organizations, both as funders and as social organizations like United Way, to be more entrepreneurial, to be faster, to be responding in a way that they haven't been able to so far. Before I forget, we have a question here related to that someone has sent in. I'll just read it. This listener has asked, what are the most at-risk populations today, in your view, and how can listeners and others help to support them now?
I think everything we're hearing on the ground reflects what we've heard from other geographies around the pandemic. Isolated seniors, those living in extreme poverty and are most marginalized. The big issues that are emerging, access to food and mental health. So not surprising, our research has been talking about the most vulnerable for decades. And the most recent research out of New York says that this is hitting impoverished neighborhoods most. It's impacting racialized and newcomer communities most. And none of that feels different than the research we've done in the GTA. And none of it is different than what we're hearing from our cluster tables as well.
So one of the things that I think is that we found in the work that we've done is some of those populations that you've talked about, sadly haven't been, I don't know what the right word is, sort of sexy in terms of funding for a lot of organizations in the past, you know, and whether that's corporations or others. A lot of these populations, these vulnerable populations, have not gotten the funding they need, and now they need it more, and they need support more. What are you saying to funders today, you know, in terms of why they should be paying attention to this now? I mean, you know, in the past you've got the big issues like cancer, healthcare, and others that have gotten the majority of education, but here it's vulnerable people, and when you're, you know, speaking to, I don't know, a large potential donor or corporate partner or others, what are you saying differently now?
I wish I could say we were saying something differently, but I'm singing the same song we have sung for decades, from poverty by postal code to the opportunity equation, which is income inequality is the defining issue in the GTA, in Canada, in the world. And this pandemic is making the invisible visible. It will and is negatively impacting those most vulnerable, isolated seniors, racialized community, those in precarious jobs. And so as much as I say, I would like to say it has changed our tune, it has made the invisible far more visible. And the hope is that we will have a greater opportunity to talk about this post-COVID.
And now someone, and actually what you just said, I think is related to a question that someone has sent in here. Grant has asked, can this pandemic create opportunities for positive change? Example, increased philanthropy, expedited housing for homelessness, more mental health support.
Grant, I think it absolutely will. I think it gives us an opportunity to say, here is the data that we've been talking about, here's the research, and here's how it's played out. I think for me, as I think about post-COVID, I think we will have to think about the resilience of our sector. There will be both big and small providers who just cannot survive. We will be forced now to think about partnerships, mergers, in a way that we had never imagined. We will be forced to think about how do we connect to systems like health, government, schools in a way that we hadn't imagined, number one. Number two, I think we're gonna have to think about data and evidence. We can no longer fund 30 before and after school programs in the same area. We're going to have to think about calibrating funding based on demographics and needs in a far more intentional and deliberate way. Number three, I think we're going to have to stop thinking about innovation as a side of the desk, something we'll do later. I wish we only had more money, and pivot to innovation as the way to go forward. In the GTA, just as a quick example, there's a group that's been bringing together, I think they're called the Friendly Neighbors Hotline. They're an online platform that is bringing volunteers together with isolated seniors in Toronto community housing. So we're going to have to innovate using different platforms on how do we deliver service in a new way. I think we're also going to have to be very, very focused as agencies, as companies, as corporate social responsibility leaders, that community is the answer. So as important as the food bank is, the early years program is, the newcomer support is, the seniors mental health is, at the core of all of that is community. And if we splice, silo, and segment ourselves, we're actually minimizing the resilience, the fabric of community. And so we'll just have to think about the competitiveness of those silos and the cohesiveness of community as we go forward.
Thank you. So much in what you just said. Thanks for sharing that. The other thing that it reminded me, I feel like we should talk for a little bit about the role, because you mentioned corporations and business and social responsibility. Of course, United Way is huge corporate partners, and you have the whole campaign every fall. What do you see as changing in terms of the role of business with respect to these issues you just talked about?
Well, I think, we've seen such a pivot in philanthropy over the past few years, and the focus on purpose, which I know at Impact is your mantra. And I think that's been so important. Never needed more than now for businesses to be connected to community. I think one of my hopes is that even business will be less concerned about the co-branding to a specific issue like child poverty or mental health for young people between 8 and 14, and be more open and to the infrastructure of community that's needed to help that kid in poverty or that young person, because these things are not separate.
Right.
And so I think business will need to continue with purpose, but also be supportive that this is a long game. This goes well beyond their corporate social responsibility branding, and they need to be entwined in the long-term game of community over the many, many years.
Which is a great point, and I think something that corporations wrestle with, because they're, it's in the short-termism of quarterly profit. It's hard to be thinking in the long game, as you've suggested, but obviously important. So we have a comment and question from Marilyn, who writes, The Economist this week has an article called The Business of Survival. And once exits from lockdown start, ingenuity, not just financial muscle, will become a source of advantage, ingenuity. So her question is, what can or are organizations like the United Way doing to drive ingenuity?
Well, I think that's a beautiful question, Marilyn. I think number one, we are delegating to the ingenuity of community. I'm less interested in thought leaders. I'm now interested in action and what is happening that is innovative on the ground, and how do we fund that? I think from a United Way corporate perspective, we have always been obsessed with community and investing in community. But as a leader today, I'm also obsessed with cash. Because for our sector to be innovative, for our sector to survive and be sustainable, we have got to obsess with our own cash and long-term ability to be around. And so this juxtaposition of community and cash, I think, will be important if we want to drive ingenuity. And I know that innovation always comes from the margins. It's not a report that will deliver. And even working with these clusters, the ideas that are coming up together may be more future-proofing for us post-COVID than what any individual agency might deliver on its own. And I want us as United Way to think about how might we collaborate differently.
Good to thank you. So we have another question from Manju from India. She asks, how do you see COVID relief funding by corporations impacting the regular funding for other running projects that you have? Are you talking about diverting funding, increasing funding? How is that? Hopefully it's not, I guess, not cannibalizing other initiatives.
That is our hope as well. Thank you for the question, Manju. The hope is that this is time limited and we remain focused on the long term of providing sustainable infrastructure. So we've been very clear with our donors. This is important. We need it for the immediate urgency of issues like food security, like mental health, but the real funding will be needed for recovery once we get back into some semblance of that. And I think those important, clear conversations have got to happen up front with donors. And for the most part, they fully understand there's time for crisis and then there's time for long-term sustainability.
Thank you. We only have a couple of minutes left, sadly. But I want, before I let you go, there are a lot of people on this call from different parts of the world, even who run organizations on their own. You lead a large organization here. What words of wisdom or advice or tips or anything like about actually being a leader at times like this, leading an organization, what goes through your head? What advice could you share with other people about how we should be thinking differently?
There's, I've said a few of these, so at the risk of sounding repetitive, I think every day I've got a series of words that go through my head, and maybe they're principles. Community first. What's the shortest route between us and action on the community? So community first. The second is cash. How are we going to keep our own cash flow so that we can distribute cash to the community? Right. Number three, collaborators. Who can I think about to collaborate with for long-term sustainability? People I never would have thought of before. And finally, this mantra that everything is possible. It would have taken us years at United Way to move to having 250 people at work. And we did it over a weekend. So I will never take no, that's not possible as an answer anymore. Everything is possible if we focus resources on that.
I love it. Thank you so much. Well, I think we could talk all day about this. So I really, so first of all, I so appreciate your time, Daniele, and also the support of your team at United Way Greater Toronto. The work you do has always been great. It's more important than ever. Also wanted to thank our team at Impact, who've helped bring this to life and remain, as always, 100% committed to social change, which I deeply appreciate. Also wanted to let everyone here on this call know that this conversation with Daniele is being recorded and will be available, I think, starting tomorrow. I think everyone who's on the call will receive a recording of that. Also, next week at not exactly this time, I believe at 11 o'clock next Thursday, rather, we're going to have the great pleasure of being joined by Stephen Huddart, who's the president and CEO of the McConnell Foundation, I think one of the biggest foundations in Canada, and also a great expert in social innovation. So, Daniele, thank you so much. I so appreciate your time. I appreciate everyone's participation today. We look forward to seeing you next week, and stay safe. Thank you.